This is LiveWell Talk on anesthesia and surgery. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. Today we're talking about one of the reasons patients are choosing St. Luke's for surgery, a unique partnership that's helping deliver safe and advanced surgical care in Cedar Rapids. St. Luke's exclusive collaboration with Linn County Anesthesia, the area's only anesthesiology group. Returning to the podcast today is Greene, President of UnityPoint Health, Cedar Rapids, to talk more about how this partnership is improving care and delivering a peace of mind for patients, families, and I'll also add medical staff and surgeons. Welcome.
Thanks, Dr. Arnold.
Staff members and colleagues that are listening to this podcast know exactly what anesthesia does and et cetera in the relationship with the hospital. Pre-agreement, post, right? I mean, I think people understand that. But could you just tell us for the listeners, what is the benefit? What does anesthesia do, and hence the benefit of them focusing on the excellent care they provide here at St. Luke's?
Yeah, thanks for having me. First of all, good to be back. This agreement with Linn County Anesthesia and our exclusive agreement has really allowed us to continue the excellent care we provide and have provided for many years. Linn County Anesthesia has been in our community, known in our community for 60 plus years. And what they provide is that safety for the patient, that high quality experience and quality surgery for that patient. Just as important when you're going into a surgery is that surgeon as well as your anesthesiologist. Yeah. And in some cases, more important, as you know, each procedure starts with that anesthesiologist. So this exclusive arrangement has really allowed us to secure that high quality care that we want for Cedar Rapids residents. You need to know who your anesthesiologist is. You need to know who's providing that care. As I said, just as important as that surgeon. And then to further that partnership that they provide in the OR.
Yeah, I think, could you talk about the efficiency that provides for scheduling cases, getting cases on?
Yeah, anesthesia is an important component for that care. I would argue access is our biggest differentiator. Access and your experience. You want to receive that care when you want it throughout healthcare. So you want to get that procedure on. And then if you can get that procedure on, you can get into your doctor as an example. How you're treated during that experience is what you tell your family and friends. So this access, it's improved access for us. So we have a certain number of ORs that we can run per day. We need a team. We need an OR, a team being our surgical team. We need an OR, we need a surgeon, and we need an anesthesiologist. If you don't have those four components, we can't schedule a surgery. So increasing our access means we can run those ORs longer in the day, we can see more patients, and we can get more patients into our facility. And that is an impact, a positive impact for our community. And certainly an improvement on our access as we've secured this exclusive arrangement with Linn County Anesthesia.
Yeah, I don't think even some of the members of medical staff and nursing might not appreciate that the more efficient you can run your OR, it has a halo effect to the rest of the hospital. Patients don't wait in the ER as long. And you have better throughput and discharge patients back to home. That's what our goal is.
Yeah, it's really been throughput in the OR. Yes, that's important, and we've invested in resources in our ORs to make sure that we can meet that demand, which we have been. But it also flows to, as you said, post-anesthesia, our Surgicare, our PACU, onto our orthopedic floors to make sure that they're staffed appropriately to continue with that throughput. The quicker we can get patients through in a safe manner, of course, the more patients we can accommodate here in our community. They can get their cases on. There's no reason to leave Cedar Rapids for that care.
Yeah. Well, and, you go to other countries and, the delay in getting care and, we're really spoiled in the United States, particularly here in St. Luke's, of the efficiency of care and access. We really stress that. So, anesthesiologist is just not in the OR. They're also in other aspects, pain management, pain clinic, so it allows some flexibility there. But tell us about their relationship with the birth care center.
Yeah, good point. Just first off, you're right. Anesthesia obviously provides services in our pain clinic, upstairs in GI clinic, for example. Some of those procedures are done under anesthesia. Yeah. Cardiology. if you're coming into the cath lab or EP lab, you need to know who that anesthesiologist is, and that's allowed us to improve access. But birth care center is another example. Almost all procedures over there are done under anesthesia with epidurals, et cetera. That's all placed by an anesthesiologist. So an important team member to our care team. And again, having access to that allows us to meet the needs of patients in our community. Birth care center, we do, 80% of births in Linn County are done here at St. Luke's. So need to make sure we have adequate coverage for birth care as well.
Yeah, I think the biggest, you don't realize as a clinician or a physician how much time you spend running in between the hospitals if you're on staff at both. And historically, it was the physicians were a third-party entity between the two hospitals, but just the physician LiveWell balance changes dramatically when you're just focusing on one. I've experienced that myself in my career, in talking to some of the other specialties as well as the anesthesiologists. It's working really well for them, isn't it?
Yeah, that. I'm going to refer to it as productive time.
Yeah.
When you're engaged with a patient, that's what physicians want to do and clinicians want to do. They want to interact with the patient. They don't want to spend their time driving down 10th Street to other facilities. And we've seen that with other specialties as well, that the more efficient we can make their day. As an example, very specifically, we have 12 to 15 ORs here at the hospital. Having one anesthesiologist dedicated to that OR all day long, they're consistent in that room seeing patients throughout the day. That's far more efficient than spending your morning here and your afternoon at the surgery center or at another hospital here in town. So it's really been a game changer for the group as well, and the feedback's been really positive in terms of their satisfaction.
I think I've said this on other podcasts. I've said it in meetings. You've heard me say it. I had no clue on how complicated it was to schedule a surgical procedure. How many different people touch that patient or interact with that patient, from the pre-op, the anesthesia, and scheduling, all that. Yeah. I think if people will be surprised that it is not just put it on for 1:00 today. Right. A lot goes into that.
And you can appreciate, knowing what goes into that, how difficult it is to get that patient on, or the coordination involved to get that patient on. The last thing we want to do is cancel a patient because we don't have anesthesia coverage, the room available, et cetera. So this has really allowed us to increase our access, but also a lot more predictability in that scheduling process. We know we've got an OR schedule tomorrow that has X number of slots in it. We're filling up all of those spots, and we'll have the team available to meet the needs. So yeah, it's exactly right. It's a complex process.
I think one thing that to describe just as a benefit of this relationship, one, Linn County Anesthesia is some of the smartest doctors on staff. I really enjoy working with them. All board certified anesthesiologists, well trained. But now they can help out with some things on the fringes, sedation for MRIs, sedation for cardiac procedures, to make it a safe experience for the patient and as well as the clinician perform that. In this partnership, I've seen that benefit of that already in this relationship.
Yeah, the other dynamic that we haven't gotten to yet, but the relationship between the surgeon and the anesthesiologist. Don't underestimate the importance of that. They work together during your procedure. One often knows your next move as a surgeon. Yeah. That anesthesiologist, they know that. That team working together, that increases the positivity in our outcomes, the quality that we have. It's not a different anesthesia coming in to cover that procedure. It's whoever, Dr. Bodkin.
Right.
I've worked with Dr. Bodkin for 20 years, and I know exactly what she's going to do. And as a surgeon, I'm comfortable with that. So that's helped, certainly.
One of the guiding decision-making for this podcast is to communicate to the community what we do as a hospital, and physicians and nurses and staff and therapists, et cetera, cancer center, all that. Mm-hmm. It's community cancer center, right? Community cancer center. What is it? What's the investment from a standpoint of this relationship for the community?
Yeah, that's a good question. It's not uncommon. or not unknown, there's a shortage of anesthesia throughout the nation, and the world for that matter. This move has really allowed us to be proactive, to make sure that we've secured this coverage for our community so that we can meet the needs of the community and they can have their procedures right here in Cedar Rapids. So making this exclusive arrangement with Linn County Anesthesia, it's that guarantee that we will have anesthesia coverage at St. Luke's and the surgery center as a result of this partnership. So it's absolutely an investment in our community. We're committed to this community, and we want to make sure that that care stays right here in Cedar Rapids. Very high quality. We were named a top hospital. You know our quality accolades. There's no reason to venture south or north on 380 to receive that care. You can get it right here in Cedar Rapids. So really proud of this partnership. Give a lot of credit to Linn County Anesthesia. They've been a wonderful partner through this and really making sure that we're both winning in this relationship. And the one that wins the most is our community members, that they can get their procedure on when they want it with a high quality surgical team. So it's an investment, certainly. Excuse me, but it's a proactive approach that we made to make sure we don't have a shortage of anesthesia anytime in the future.
And one thing I probably should have mentioned a little bit earlier is Linn County's, they were just such good partners during the pandemic.
Yeah.
Because, we shut down ORs and that really impacted them,
Right.
But they were just very, very good partners during that time. Dr. Bach and her leadership and other anesthesiologists, Dr. Greene. It was a good relationship. And part of our success that we had in treating patients during the pandemic, they contributed significantly to it. If you remember, they acted as respiratory therapists to care for patients.
I remember that. I can think of very specific examples that our ORs weren't running, or they were running at
and they
limited capacity.
They stepped up and functioned as respiratory therapists.
That's right.
I've never looked it up or asked around, but I would imagine that was a very unique action on their part compared to other anesthesiologists.
Yeah, that comes back to my earlier point. This group, they live in Cedar Rapids. They care for this community at a deeper level, and they're committed to this community, and that's what I'm most proud of. And they're part of our team, and that's what we want moving forward.
Casey, thank you again for joining me and informing our listeners about St. Luke's exclusive partnership with Linn County Anesthesia. Once again, this was Casey Greene, president of UnityPoint Health, Cedar Rapids. To learn more, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.